but I would think that's part of it.
I'll wait for...
Yeah, well, we'll see if we can get that, and if you will, I'll go to Columbus, and then we'll get back to you. Columbus, please. Okay, Mr. Oliver, then Height.
Actually, Mr. Mayor, I was going to propose a $10,000 reduction.
I'm listening.
In this budget, although I see as I look at it, it already is a reduced budget from the previous year approved, and a levy requirement reduction, obviously a significant levy requirement reduction. But I was listening carefully when you asked a couple of questions regarding actuals versus budgeted amounts, and the actuals, at least projected actuals, being down in a couple of those support categories. So, Mr. Mayor, I will propose a $10,000 reduction in this expenditure, in the levy contribution to this budget for 2017, and I don't care where it comes from. I guess it's just a number.
So you're looking to reduce
HR and staff development by $10,000.
Say that again.
The HR and staff development division budget by $10,000.
Okay, so the net requirement proposed is 85.1. You would like to see it go down to 75.1.
Correct.
And where staff works the figures in will be up to them, correct?
Correct. Thank you.
I'm going to that motion is on the floor. I'll open it for debate. I know I have other speakers, but there is a motion, and we'll speak to that only. At this time, Councillor Columbus and then Black, please.
Yes, just with that, can we ask Candy what hardship that would cause to that department?
Candy or Stephanie, if you will.
Sorry.
Everybody else.
Sorry. Thank you. Thank you. Through you, Mr. Mayor, I'll start, and certainly if Stephanie or Trevor would like to jump in, by all means. I think what you can see from this budget is certainly, I believe that the HR staff have been quite aggressive when it comes to reductions. Whether the $10,000 would cause a hardship, certainly that's something that staff would have to go back and further analyze. Although, as Councillor Oliver did indicate, certainly they have sharpened their pencils when they prepared this budget for presentation to you.
Anything else? Councillor Black is next.
Sort of the same question. If we did reduce that budget and you had some problems, I guess, what's your recourse? You would come back to council as a budget amendment or something like that? Yeah, okay. Thanks.
Any other discussion on the motion? Motion is then to overall reduce this budget further, sorry, not further, but $10,000. I'm going to call the question. Those in favor? Those opposed? That's carried. Back to Councillor Height. I haven't forgotten you. Do we have the breakdown here for Mr. Brunton? Then I'll deal with this, then I'll go to Councillor Height.
Okay, do you want to pull it up? Yep, go with the corporate. Go out, you're too far. Go back. Okay, go under corporate right there.
Doug, sorry, Mr. Brunton, Councillor Brunton, your question was a breakdown of the for meeting expenses.
It's coming.
Okay, then material supplies. And 4180. 4181. Can you highlight the whole column just so that they can see? Does it highlight?
So the proposal for this year total is $119,000, Mr. Ford, $700 or something like that?
Yeah. So we could do this, Cindy, so they can see the whole thing.
It's 119,000, yes.
119,700, and it's up a substantial amount, I think. Mr. Brunton, go ahead.
Well, I guess my question is, what does that involve? The mileage would be separate if they travel, I assume. We pay the staff. We own the buildings we meet in, I guess, if they're local. So what does that expense for? Well, I realize that, but that would be basically mileage. We pay the people. Well, can somebody break
I
that?
guess we're looking to staff if they could identify what items are covered under the meeting expenses. Mileage is separate from a meeting expense. I'm thinking that any type of coffee and food is part of that. Councillor Wells, do you wish to comment? I'll get to you in just a
The
second.
comment I wish to make is, I think even though we own the buildings, my understanding is we still pay rent for the use of that building the same as anyone else.
Mr. County Manager, comment?
Through you, Mr. Mayor, that's exactly right. But this does catch a whole bunch of things. I mean, certainly I know, for example, if the mayor and I go to Western Ontario Wardens Caucus meeting, certainly our mileage goes somewhere else. But if you pay for parking and a meal, it's going to go to meeting expenses. You know, if there are meetings where, let's say, Health and Social Services brings, or the health unit brings staff in for an in-service meeting, they are going to have to pay for the space, even though it might be at a county facility. It's obviously has to be logged as an expense to that, and obviously if they have a day-long in-service, which is, you know, logical, I guess, in terms of being efficient and doing the in-service training as much as you can, then you're going to have some meal expense to put that on as well. So it would be very hard to generalize. You know, I know certainly, you know, there are probably different cases in each department and division of what may end up in that account.
Anything further, Mr. Brunton?
I give up. Thank you.
Councillor, don't give up. Don't give up. Councillor Columbus?
Yes, I know in the past, I believe that it comes across to all divisions, not just HR, where the county has paid for tuition towards a master's degree. Is that still occurring? And do we have any of those on the books where we are assisting an employee in paying for their tuition towards a higher education?
Through you, Mr. Mayor, yes, Norfolk County in our strategic plan, and we have identified ourselves as a learning organization. So certainly we have a policy, and I believe that those provisions have actually been in place since transition, when the policies were originally adopted by Council. And there is a training and development policy that does speak to assistance for employees with tuition fees, textbooks, and so on. There are different levels of support that the organization Norfolk County supplies, but yes, in some cases, if it is approved by the general manager, and in some cases the county manager, then yes, there is certainly assistance to employees.
And do we have many of those go through in a year?
Through you, Mr. Mayor, yes, we have a number of individuals that through the years have taken, for instance, the Masters of Public Administration program, but there's also other programs through AMCTO and other secondary schools and organizations, and Council has seen a number of those individuals being recognized at Council when they've received their diplomas or certificates.
Anything further on this 4-29? Oh, Councillor Height, thank you.
Thank you, Mayor Luke. My comments had to do with the meetings, and I'm wondering if we couldn't get a report that shows us like the actuals, approved budget, and the adjusted budget by department. And the reason for this is I'm thinking about moving a motion to reduce that, but I don't want to punish people that have come within their budget. Okay, this particular account was $28,000 over budget. Okay, and the problem I have with the departments and some of these accounts going over budget is it takes away from another initiative. So Norview, for example, if they spent $28,000, and this is just an example, on meetings, what did the people lose on the other side? Because they still only have a certain amount. And for me, like, to move the motion forward to say, in general, I want to see a reduction in meetings. I don't want to see the people that are diligent in keeping within their budget, be punished across the board as well.
If I hear you, and I did, you would like to see some sort of a report or a memo showing what each department is for their 2015, 2016, a year of, to look at how many departments are sort of over budget or under budget or whatever before you consider an overall reduction. Is that fair?
For the meetings, if we could.
Okay, that's what I think you're after, yes. I'm going to ask Mr. Ford. Mr. Ford, would that information be able to be brought forward to council by department? You've given us the breakdown by county. Would you be able to get that information for us?
Yes, Mr. Mayor, we can do that. I'm just looking at what the bones of the report look like.
Okay.
And it's in some instances it is by department, but in other instances it's based upon what kind of a meeting it was. So we can produce the report and give it to council. Certainly, that's not a big deal. And we should be able to produce it on the off day tomorrow.
Yeah, that was my next question, if we could get it before on Friday, because based on the actuals last year, the budget is substantially over on meetings for 2016, and you'd like to see the breakout. Mr. Ford has told me that he would get us in some format, the best he can, okay? Thank you. Anything else on 429? Well, I think it's time to go to finances. Ladies and gentlemen, thank you very much for your assistance. Smile, Candy, you're smiling, right? Okay, good.
Thank you, Mr. Mayor, and I'm sure Carly enjoyed her first experience
Well,
with council.
you were
I
right.
think she'll be back.
She was excited to come here. She's probably more excited leaving, I'm sure. Thank you, Trevor, and Stephanie as well. Financial Services Department. I'm going to 431 and 432. That's what we have on this department. As you can see, an increase suggested of 1.1, some $25,300 on a $2.25 million budget, roughly. Sorry?
Thank you, Mr. Mayor.
Oh, I was looking at the net levy. I'm sorry. The county manager's right. They do operate at roughly $3.3 or $4 million. Go ahead, Mr. Ford. This is you.
Thank you, Mr. Mayor. As you said, the budget overall has a 0.1% increase in the levy from last year. There's no change in staff from one year to the next. There's a number of adjustments up and down because there's some of the things that are related to the new financial systems that are causing some increases, but also some decreases as well. So some of those throughout the budget. And, you know, with going into each individual item, I think if council has questions, I would certainly answer them.
Go ahead. I'm sorry.
One of the things I'd like to point out when you look at the page 4-30, I think something good news story there is that the percentage of our payments in 2016 that were paid by EFT, by electronic fund transfers, 75% of the payments were done by EFT. In the past, that would have been 100% by checks. So we've eliminated some postage, paper, and a whole bunch of other things, and some effort on the part of staff to do, you know, all of that clerical grunt work related to producing checks, stuffing them and mailing them and stuff like that. So we're very happy about that. We continue to press that number higher. You see last year it was at 53%. It's 75% at the sort of about the end of November, middle of December. And we see that number going up every month, every check run. It doesn't go up as fast as it did initially, of course, but you know, slowly and surely we're moving it up. The other thing that we did during the 2015 period was we've moved from a bi-weekly check run to a weekly check run, or a weekly payment run, and that's because of re-engineering the business process, electronic payments, and a whole bunch of other things like that, that provides a much better service to the customers and provides a better accounting internally. And of course, considerably lower than they were 3 or 4 years ago. So, whoops. So I'm prepared to answer any questions that
Councillor Black is ready to fire away.
Just read on what you said there, John, about the electronic transfers and all that. Are you able to quantify that into cost savings? Like what? I'm sure there's cost savings here, but do you know what they might be?
I don't know how many checks. Do you know how many checks did we issue? Yeah. 20,000? Yeah. James is saying that we probably issue something like 20,000 checks. So if you take 3/4 of that, that's 15,000. So there's a big chunk of postage saved alone. But that's not all reduced in 2016 because we did reduce some of it in 2017. There is a minor reduction in postage for 2017 because of the continued improvement in the number of people who get paid by EFT, but we've reduced the budget in postage for 15, 16, and a little bit more for 17.
Thank you. Councillor Height.
Thank you, Mayor Luke. Through you to the Treasurer. As your total arrears go down, I'm assuming that the revenue of the interest made on that also goes down? That's correct. And where is that booked? Is that under the unallocated revenues?
No, is that said here? No, where is it unallocated? Interest and penalty, interest and taxes. Is it in our budget? Okay, it's in the corporate, but the interest on arrears taxes is in the corporate budget, not in the finance department budget.
No, so it's up in the corporate side or in the unallocated?
It's in. We have a separate budget for unallocated. It's included in there. We talked about that yesterday. It's included in there.
That's where it is? Okay.
Yes.
Thank you.
Thank you, sir. Anything further to Mr. Ford's department? I'm going to move on. Councillor Brunton, sorry, go ahead.
Yeah, just a question to John, if I may. How's the setup going with the water and sewer billing?
I think I'd like to have Lee respond to that, but
get back here.
We're in the process right now. I can tell you, at a very high level, we're in the process right now of working through with her. I'm not involved in it directly. Somebody in Lee's department, Jason Godby's involved with it directly, but we're working through the process of the changeover, which will occur at the end of February. March 1st, building starting in March 1st. My understanding is that we're bouncing along quite nicely, and everything is falling into place the way we anticipated it. But we're not at a point yet where we're cutting over to the new billing that will happen in March.
That's all I need to hear. Thank you. Sorry, Lee.
Might add, Mr. Mayor, that there's one other thing I might add is that council asked for a report on adding uncollected water accounts to taxes. That report is near final, and I hope to get it to the first CIC meeting in February. Worst case, it'll be the second CIC meeting.
Thank you.
Okay, and I'm ready to move on then if there's no further questions on finances. Now, Health and Social Services next in the binder. I think Marlene may be in the back room. Oh, okay. Well, we can take a moment and stretch, and she'll be in a moment. Okay, so that sounds good. While we're waiting, maybe some housekeeping. Councillor Wells, did you tell me this morning you were prepared to go to 5 o'clock today? Oh, okay. I guess you didn't, now that I recall. Do you have any... it's just easy to ask you rather than suggest something and... Well, we'll have to get a consensus for that. That's your idea. Jeez. I wouldn't be alive if I was married to you. Can I have a show of hands that agree to 4 o'clock? Okay. I think we're moving along here. You never know. So, Councillor Wells, it will be 4 o'clock. And just remember, if you're not happy, you're not chained to that seat. Thank you. Mr. Brunton.
Are we waiting for something?
Well, I would like to get on with Health and Social Services. We need some staff here.
Okay, well,
They
can
are
I ask?
right over there, so in the meantime, go ahead.
Well, it has to do with Kathy's handout. And
Okay,
it's
I'll
kind of,
entertain that.
Okay.
Go ahead.
Under, I look at the RAB building, and Jesus.
What have you been drinking out there?
She's fine. Okay, sorry, Doug.
Well, it's just a quick question, and maybe
Go ahead. No,
maybe
I'll
the
entertain
county
it.
manager could help me with this. But there's this handout Kathy gave us shows some service costs over 50 grand, and in there is the RAB, and it's the lease is at 911,000 a year. Janitorial services are another 53,000, and on I assume utilities would be added to that too. Now, you come down further, and they have the lease agreement for the
You're on the last page, Doug, of that report?
Yeah, it's called Attachment 2.
Thank you.
You come down to
Keep it.
the Gilbertson Drive Administration building, and the costs there for the lease are $176,000. And I don't see any other costs there. I'm sure there are some janitorial costs there too, but there's the square footage on those two buildings. I understand there's X number of square feet in both. And I'd like to know how they compare rent-wise. Because the Gilbertson Drive building is a fair size, a lot of square footage, and I realize that in the RAB, but there's a big difference in their lease requirements here.
Through Mr. Mayor to Councillor Brunton, he's absolutely correct.
Yes.
We can get you the details, but the excuse me, the per square foot lease payment for RAB is substantially higher than the per square foot for the Gilbertson building.
I realize that, but I'm just wanting to compare.
Yeah, we can. I don't have that off on my
Okay.
fingertips, but we'll get you a summary of what those costs are.
Be interesting. Thank you.
Mr. County Manager?
Through you, Mr. Mayor, I just would report as well that with the additional space that was taken in the Gilbertson building, we had certainly an arrangement with the owner. In fact, the total lease payment was held pretty much constant, and so the lease per square foot actually came down. Although obviously, when you take after the expansion and the additional space that was taken a year and a half, 2 years ago, obviously there was a significant amount spent on leasehold improvements and other capital, and obviously ongoing operation and maintenance costs for utilities and that sort of thing have gone up as well. But there's no question, very clearly the lease rate per square foot came down because of the essentially the offer that the landlord provided to Norfolk County for the health and social services accommodations.
Councillor Wells?
Thank you very much, Mr. Mayor. And Mr. Mayor, certainly Councillor Brunton is correct. There's no doubt to anyone sitting around this table that the rental cost of that RAB building is very expensive. But for those of us who sit around this council and have sat around this council table, we knew that going in. We knew that. I mean, there's nothing new about this. But we, as councillors of the time, decided that that was an important issue to deal with in terms of the economy of Norfolk County and Simcoe. And we invested in that because, as we all know, that building sat derelict or that property sat derelict for quite some time. And so as an economic generator, we decided that we would invest in the community. And unfortunately, in order to invest in the community, it costs money. And someday, it is my hope, I won't be here then, but someday when that unit, that property
Development, yeah.
is developed properly the way it was envisioned, we will get our money back in taxes. But until that happens, it is expensive, and I will tell you now, I'm aware of that. And so we, as Norfolk County Council, made that decision. Was it the right decision? Eventually, it will be the right decision. Thank you, Mr.
Okay,
Mayor.
Mr. Ford is getting Mr. Brunton some figures there. I'd like to get back to this. You had a quick question. I think we've got an answer. Anything else? Like, I don't want to debate rental on these buildings when we're in the middle of our starting our health budget. Go ahead. Okay, thanks. Thank you, Mr. Brunton. I appreciate that. I see that, Marlene, you've arrived. Thank you. And Mr. Nolan from Norview is with you. I am on page 4-33. And, of course, this is roughly a $9.1 million budget that is looking at a 1% increase. There through to 4-35. Marlene, any comments or anything before we get into the details? Go ahead, please.
Thank you, Mr. Mayor. I apologize for the delay. I was in the back, and the rest of the staff should be here shortly. Okay. So I will provide to council my opening remarks, just so you have on hand as you can review also. But the Health and Social Services Department includes social services, social housing, Norview, and public health, as you heard yesterday. Presented today is a gross budget of approximately $48 million for social services, social housing, and Norview. The budget has an overall increase of 1% to the levy to a total increase of $90,000. Much was accomplished in 2016 in all of the divisions. In social services, initiation of an organizational review of the Ontario Works program was commenced. The opening of a new licensing care center at Lakewood Elementary School in Port Dover, and the initiation of the community planning process for the early years child and family centers. In social housing, there was full utilization of the federal and provincial funding for affordable housing and homelessness prevention, including the Social Infrastructure Funds, Social Housing Improvement Program, and the Survivors of Domestic Violence Portable Benefit Program. Norview implemented the enhanced mandatory Ministry of Health and Long-Term Care Quality Inspection Program, had another successful resident quality inspection by the Ministry of Health and Long-Term Care, and also a successful infection prevention control inspection by the Ministry of Health and Long-Term Care, and also had several capital updates throughout 2016. These are just a few. I would like to take again this opportunity to thank the Norview staff for the exceptional care for our elderly and the work of social housing, social services, and the support teams for all their efforts to reduce homelessness and poverty, minimize the social determinants of health to some of the most vulnerable populations within our communities. In 2017, social services and social housing budgets are based on the same levels of service other than the provincially mandated services that are new and the following new budget initiatives which we will review. Social service budget includes a new budget initiative for an additional 1 FTE in the Children's Services Program to deliver the provincially mandated wage enhancement program for our licensed child care centers. This position would be fully funded within our provincial funding envelope from the Ministry of Education with no impact to the municipal levy. Social services budget also includes a new budget initiative to add preventative dental care for social assistance recipients in the Ontario Works Discretionary Benefits Program. This new business initiative was the subject of a deputation from a community member during the opening day of budget deliberations yesterday. Social housing budget includes a new budget initiative also for 1 FTE for a financial clerk. This position would be a shared position with social services and is funded 50% from Ontario Works provincially funded cost of administrative budget. This position is required as a result of the reorganization with the financial department and is responsible for completing all accounts payable for social services and social housing, completing the year-end financial reconciliations for all of social housing providers, and submitting this report to the Ministry of Housing, and the completion of Ontario Works subsidy claim to the Ministry of Community and Social Services to ensure that the municipality receives the accurate level of funding back from the ministry for payments to clients. The social housing budget also includes a new budget initiative to change the funding formula for one of the non-for-profit housing providers, Parkview Metals. 100% of this cost will be recovered from Haldimand County, as the housing is physically located in Haldimand County. The NBI has been shared with Haldimand County staff. Overall, Health and Social Services employs 312.35 FTEs, including public health. The budget has been increased by 1.64 FTEs. 0.64 FTEs includes 0.64 FTE increases for social service is attributed to the NBI for children's services, and 1 FTE in social housing is attributed to the NBI for the financial clerk to be shared between the two divisions. In social services, the provincial contribution for all of the OW payouts to clients continues to increase annually, 3% over 2016. The municipalities are required to contribute 2.8 in 2017, and in 2018, all costs will be uploaded to the province. In 2016, the Ontario Works caseload was 1,624 households in Haldimand, Norfolk, and we maintained a 2-day turnaround time, which is below the provincial benchmark of 4 days. The average number of months for a household to receive assistance was 28.4 months in 2016, down from 31.3 months in 2015. We continue to work through the challenges associated with SAMS and the transition of the software, as you're well aware. While the functionality has improved in some areas, it continues to not operate as anticipated, particularly in the areas of financial reconciliations and the preparation of the required subsidy claim for the Ministry of Community and Social Services. The level of provincial funding for our children's services programs is essentially the same as last year, and we will use the entire allocation to support child care fee subsidy for qualified families and the operations of our licensed child care centers. In 2017, Children's Services will be notified by the Ministry of Education of our funding allocation for the Ontario Early Years Child and Family Centres in advance of the implementation on January the 1st of 2018. In social housing, there are currently 244 applicants on the centralized waiting list for social housing. The breakdown of applicants remains fairly constant, with 52% of the waiting list being single adults and childless couples over the age of 65. 18% of families with dependent children and 30% are seniors. The division will be receiving a slightly higher level of provincial funding in the Community Homelessness Prevention Program, or CHIPE, as compared to last year. We are in the 4th of 6 years of the investment in affordable housing with the 2014 extension program, and will continue to offer all the programs in the funding envelope, including Ontario Renovates, affordable home ownership, housing allowance, and rental supplement. In 2017, the Social Housing Division will also deliver the provincially and federally funded social infrastructure funding and the social housing improvement programs, as well as the second year of the 2 years Survivors of Domestic Violence Portable Housing Benefit Pilot Program. The division will also host the second Community Housing and Homelessness Forum and undertake a mandated enumeration of the community's homeless population. For Norview, document has been reviewed and improved. These document changes provided an increase in the case mix index in April, which showed an increase of $12,500 which is a premium increase of 19 cents per resident per day. This carries on from April the 1st, 2017 up to March 31st of 2018. With the addition of the new document system that is currently being implemented of point-click care, there's a potential for yet another CMI increase. There has been a cost increase in hydro and a wastewater of $24,500, also to the Norview's budget. Norview Lodge, for the 2017 budget, has a 1.5 total increase. The increase has a 1.2% previously reported to council wage and benefit increase for staff through collective agreements, and also there is a 5.2 increase for hydro, which is out of our control. Finally, there has also been substantial capital items added to the budget for replacement of items that are required for daily needs of our 179 residents at Norview Lodge. There's been capital additions to ensure Norview is in compliance with ADO legislation, and the Norview team, with these increases, has had to have a budget with minimum increases. From the administrative perspective, there is an increase of $17,500 for personal protective equipment and 72-hour workplace emergency kit. The quantities recommended as per the Ontario Health Plan for influenza pandemic will be purchased over the next 4 years. This amount is the first quarter of that of the need for those protective equipment. There is also an increase of one-time consulting services of $15,000 as Haldimand County is moving forward with the centralized accommodations in Cayuga, which is to be completed by 2019. Health and Social Services occupies and shares space at both the Caledonia and the Dunnville sites, with an accommodation assessment is required to analyze accommodation options as per the staff report 1631. And with that, I'd be happy to answer any questions. Thank you.
Thank you very much for that information, Marlene. Questions? I'm just keeping 4-34 and 35 open. These are summaries. We'll be getting into them individually. Are there any questions on these 2 pages? And of course, they'll be broken down here. We're going over the next department. Marlene, just to keep things moving, do you want to do these in order? Do you want to do Norview first, since we could maybe get Mr. Nolan out of here by noon? Tell me how you'd like to proceed. I think it doesn't matter which order. Any thoughts?
No particular thoughts.
Let's go to Norview. And we'll come back then to, I think it's 440, oh, you'll find it down below there. We'll come back to the administration in a moment. There we are, 445 it starts, but let's turn to 4-46, 4-47. Mr. Nolan, anything to say before we start firing some questions at you?
Through the mayor to the council, no, any questions that you have, I'll be more than willing to answer.
Thank you. Councillor Columbus, we'll begin with you, sir.
First question, how many people have we got on the waiting list to come into Norview? And what is the length of time, the wait for that?
Through the mayor to Councillor Columbus, it can vary from month to month, but generally speaking, they have 2 levels on the waiting list. Those that need immediate placement due to crisis requirements, and they would go to the top of the list. So even if there's been somebody on the list for 6-8 months, if the crisis comes in deemed by CCAC, which is our governing body, they will move them to that appropriate list. But if you're generally speaking, we have had people on the list for over a year that have waited to come into Norview, if you're looking for a general answer to that.
And what's the number of people on the list?
I don't have those stats through the mayor to Councillor Columbus. I don't have those stats with me because it does change daily. There's a portal which all the people are put on, and they have to choose a number of homes. So they could be on Norview's list as number 2. We could have 20 to 100 on Norview's list as number 1. It really is updated by CCAC. We have no control of the list, so the numbers change as everybody requires admission to long-term care.
Okay, thank you.
I want a quick question on the consulting services, and obviously you've explained why so much the increase of the $50,000. But in your explanation, Mr. Nolan, the inspection of the storm sewers is to be 100% funded through OCIF, some kind of fund, government money, correct? And if so, is that reflected? It's certainly in the expenditure. Is that reflected in your revenue figures as well, that 50,000.
To the mayor, that is correct. Both the cost of the expenditures and the revenue, which is 100% funded, is reflected.
Just checking on you. Thank you.
Thank you.
Further questions for this gentleman, Councillor Sonnenberg?
Challenges and emerging trends. Increased in-depth care needs of patients. I always thought that patients got excellent care there. Where is there room for improvement or need for improvement?
Through the mayor, thank you for the compliment, and you're correct. The staff of Norview do an exceptional job. I have the luxury of working in other long-term care homes, and Norview is the top of the bar. They really are. When you talk about challenges in care, as our residents come in at a later place in age, they come in with more challenges. That leads us to adapt to more educational requirements, more equipment to provide that care. And on the flip side of that, we also have quite a younger population moving into long-term care that are not fit by CCAC and the Ministry of Health guidelines anywhere else. So long-term care becomes the end stop. In past, there was different levels of care, but at this point in time, long-term care is where quite a few of our residents that would have went somewhere else previously come to. So they have a complexity of care with them, and it can list from one end of the spectrum to the other.
Thank you. Mr. Oliver.
Thank you very much, Mr. Mayor. My question, Bill, actually is on both 445 and then, of course, on the budget summary overall. And it does relate to your local food costs. I see the statistic for 2016 just takes us to the end of September. And no doubt there were additional purchases after that date. But are you confident that you're still being funded adequately to purchase local food to the extent that you and your staff team are wishing to do so? That's the first part of my question.
Through the Mayor to Council Oliver, when it comes to the purchase of local foods, we do spend the entire amount that we're granted. If the question was, could we have more money in that area? Absolutely. We do purchase a lot of local foods, but there's always the options for more. And obviously our residents, being the majority of them are Norfolk County residents, like the idea of purchasing through, and they are reviewed by our nutritional services supervisor as local foods, local products purchased through the companies in Norfolk County.
Mm-hmm. Okay, and a related question, Mr. Mayor, if I might, then on 4-47, where does our food purchase appear on that budget summary? Does it come under materials and supplies?
That's my guess, but
Or
we'll get an
contracted
answer.
services, yeah.
Through the Mayor, Council Oliver, that's correct. It is under materials and supplies, as we do consider that part of it. It is grouped together, but it is separated in the budget lines, because there is an allocated amount of $40,000 for local purchases for Northview Lodge.
That was going to be my next level of question is, what is the budget in 2017 for local within that? And you're saying it's $40,000?
That's correct.
Okay. Thank you.
Thank you. Councillor Height, please.
Thank you, Mayor Luke. I was wondering if our treasurer could pull up the contracted services. And while he's doing that, I just wanted to ask Mr. Nolan a question. I'm not sure if I got my math here correct, but it says the levy is $5.2 million. You have 179 residents. So according to my math, that's roughly $29,000 per resident that the taxpayers of Norfolk County subsidize. Is that correct?
Through the Mayor to Councilor Hyatt, I don't have the math in front of me, but I trust that with you. That levy impact is correct, the amount in the bottom, the $5 million, over $5 million.
So then, like, how much is the province funding? Is that the $8.8 million?
If you look through the Mayor to Councilor Hyatt, if you look for the provincial funding that's from the province, it's under the revenue section.
Yeah.
About $9 million, yes.
Yeah.
I think
And
That's just under $9 million. That's correct.
Okay, and then the residents themselves, they pay $3.9 million?
correct.
Roughly, that is correct.
Okay. Okay, thank you.
Thank you.
Do we have the other ones up yet? The contracted services? No, if you could click that left mouse button, that'd be swell.
It's coming.
I see it.
We'll let you have a look at that.
Yeah.
Any thoughts on that breakdown, Councillor Height?
And I'll just go over it.
Yeah,
Good, thanks.
and again, take your time. I'll ask if there's any other questions, and certainly come back to you if you see something there you want to question. Absolutely. Go ahead, Councillor Brunton, and I'll get back to Councillor Height if necessary.
Just looking at the, on that list there, physician charges, is that, when they come in there, I assume, is that not covered under OHIP in any way? Is it recovered? Bill?
Through the Mayor, Councilor Brunton, I'm sorry, I didn't hear which charges you're referring to.
Well, the physician fees there are almost 43,000.
Yes, you'll actually see again, as when I was identifying the last, it is captured under, we have to put it in as an expenditure, and then it's covered back from the ministry as a revenue for both the medical director and the physician.
All right, and I asked this one about physiotherapy. Is that a contract? I believe it is it not?
Through the Mayor to Councilor Brunton, that is correct. It is a contracted service.
Okay.
I will identify it is in the same, it is an expenditure, and then it's 100% funded by the ministry.
Okay, but how is it administered is my question. Like, is it a fixed contract for the year, irregardless of how you treat the patients, or is it by patient as they are treated? Is it a unit price contract, or is that price fixed with
Through the Mayor to Councilor Brunton. So I'll give you a quick 2016 breakdown of what happens with the physiotherapy funding. It is a fixed contract based on your number of residents. For an example, for physiotherapy, definitively, we're allowed $796 per bed per year. So that's just for the physiotherapy portion of it. And then there is a calculation for exercise classes. As you'll see, that's broken down in there as well. And that's calculated from the ministry. So what they pay us is how they break down. And that's also how our contract has to be supported when we go for the contract for our physiotherapy provider.
Well, I realize what they're paying you, but my question is, how is that? Is it like a patient that needs physiotherapy? Could be one, could be 100.
You're correct.
Okay, so how do they just, that's a lump sum charge no matter how much therapy is provided?
Through the Mayor to Councilor Brunton, that's correct. It is a lump sum charge as well as it's a lump sum funding fee. That's where the $796, that's every resident in Norview receives that amount.
Okay, so that fee will not change then?
Through the Mayor to Councilor Brunton, that's incorrect. It does change. For example, in the last 3 years, that has increased. Originally, when we put the contract out in 2013, or we started with the new process in August of 2013, it was $750 per bed per year. So that's basically per resident per year. And now it's up to $796. So the ministry, when they look at this, we do annual or monthly evaluations, as well as they do annual evaluations, and they calculate what the need is based on the usage. They still fund the same amount, but they increase it accordingly.
Okay, so your allocation is fixed.
Through the Mayor, Councilor Brunton, that is correct.
Okay.
Councillor Height, anything on the breakdown? Okay, thank you. Anything else, Councillor Brunton? I can get back to you. Go ahead, Councillor Columbus. Keep it moving here. Thank you.
Yes, Bill, how do you handle the situation where a resident has coverage, say for physiotherapy or whatever, from their previous employer? How does that all work out?
Through the Mayor to Councillor Columbus, this amount for physiotherapy is based on every resident, regardless of what their private coverage is. If they have something that goes above and beyond, that would be something that the family member, or if the resident is able to themselves, would transport to an outside physio provider. We provide that care for everybody that's in the home.
Okay, thank you.
question I have, Mr. Nolan, general question. Whenever I go through these budgets, I always look at the salary and benefits, and certainly overall, this corporation, the average on everything combined is about 2.7% increase. You have 165 plus employees. Well, I realize that's FTEs, there's part-time. And yet, cost of living is included in your 1.2% increase. You're one of the lower increases without any reduction in staff. Certainly you're not asking for any additional. Has there been some reorganizing there since last year? Like the 1.2% seems to be low, based on the average for the county is 2.7. Any just general comment? I was just curious why yours was that low.
To the mayor, the salaries and benefits are based through negotiation process, as you know, but we currently, give you a number so you have an understanding, when you base on how that percentage is broken out, we actually have 243 staff members at Norview Lodge. So when you look at the percentage being broken down of the $160,000 based on the 1.2%, it's calculated on the amount. So that's why it is lower, because we do have a lot more employees, and it's spread out throughout that.
Okay, all right, I see what you're saying. I thought I saw another hand here. Any other questions to Mr. Nolan on this budget? Again, asking for an additional $75,000 on a $5 million levy, on a $15.6 million operation, 1.5 increase. Councillor Wells.
Very much, Mr. Mayor. Mr. Mayor, just listening to Mr. Nolan and his explanation, the reason that he is suggesting that 1.2% is because they have more staff and they spread it out. Is that what I heard him say?
That's what you heard, yes. Bill, again, please.
That's correct. I'm looking over in finance if they have anything to add to that.
But Mr. Mayor.
Yeah, go ahead. Go ahead.
Using that same rationale, we have more employees than Norview, and if we spread ours out, it doesn't come in at 1.2%.
Okay, Kathy, do you wish to comment on that?
Yes. Through the Mayor to Councillor Wells, the 2016 budget and prior budgets had some estimates in there related to contracts, and when the contracts have been settled, the budget was sufficient in 2016. So you see a smaller increase in the budget this year because the budget basically in 2016 was overstated.
Last year's budget was overstated.
Yeah, because it included estimates related to negotiations that were ongoing.
Outstanding contracts that hadn't been settled yet. That's part of it. So I noticed that their actuals last year came in a little bit lower than their budget. Mr. Nolan, anything else to add to that?
Through the mayor, not unless there's any other questions.
Okay. Anything else, Councillor Wells? His salary. Right. Councillor Brunton, please.
Well, I guess, Your Worship, if I may ask Bill, it is a good budget in terms of any increase, but again, we're asking the taxpayers for $5.3 million on our tax levy. Can you give us any idea where you could save some money?
Through the mayor to Councillor Brunton, when the budget process begins back in the summer, we look at everything possible from reductions to increased revenues. We will continue to look at those throughout the year. We have had, if you looked at some of the increased revenues that we have received, they are small amounts when you look at the large amount of the tax levy, but they are increases in the right direction, such as there is a, it's called a SGP or Silver Group Purchasing revenue, and it was increased by, almost 50% of what it was originally. And it is on the increase. So we do look at revenue increases where we can. But as far as reductions, we have looked at all of our potentials, and have things that we've been able to reduce. But we are basically where we are. We're at the mercy with a lot of things as far as utilities and those types of things.
So you have no ideas.
Through the mayor to Councilor Brunton, we have had a lot of ideas and we've put them into place. And that's what we've come up with, which we think is a very well-rounded budget, given the fact of what our total is and the fact of what we do for Norfolk County with Norview Lodge.
Thank you.
Anything further to Mr. Nolan? I hear none. Bill, thank you for being with us. We will now do lunch. I'm thinking 12:30. Back here. Well, of course, where else would we come? And I believe we'll go to administration or somewhere in the budget. Thank you.